So now I'm going to open my catheter tray. I have Mrs. Jordan all set, and there's usually a perforated edge at the one end of the catheter packaging, which I have there. And I'm going to keep this bag here and put it at the bottom of the bed in case I need that for any garbage. So I'm going to open up my tray, but before I do, I will tear off a piece of tape that I can use to secure the catheter to the inner aspect of Mrs. Jordan's thigh. I'm going to hang it right on my table. Otherwise, you can use what we call a flex track. We don't actually have any in this agency at this time. So I'm going to open up my tray, and I'm actually going to pull it taut away from me. And I'm going to be careful to remember to touch only the outer aspect of the tray and the 1-inch border. Underneath this little flap is the pair of tongs that you're going to need. So I'm going to take them in my right hand, and I'm going to use them to help me square off my tray. Okay, and I'm actually going to move my tray over a little bit so that I can extend my sterile area there. Now the tips of my, when I put the forceps down, I have to ensure that I put the tips inside the tray past the 1-inch border. But before I do, I'm just going to remove some of the items on my tray so that I can access my gloves. So I have a drape that I'm going to put over here, and I'm going to lay my gloves right here that I can use. And I'm going to put my other tray there, my other drape there as well. Now, within the tray, there's a number of items. There's your gauze to clean, there's the cleaning solution, the pre-filled syringe, the lubricant, and a specimen sample bottle. I actually don't like to touch the inner aspect of that tray until I have my gloves on. But you can do that. If you prefer to move the contents around with these tongs, you can do that as well, whichever works. As well, there's another pair of tongs inside. So I'm going to lay these down now, ensuring that the tips are beyond that 1-inch border, so they are going to remain sterile. And now I am going to add my catheter to my tray. There's a couple different ways that you can do this, and again, you want to make sure of the expiry date on the catheter, and you want to make sure you know how much fluid can be used to fill this syringe as well. So I'm going to peel this open, and the few different ways that can be done to open the catheter and get the catheter onto the sterile field. You can open up the catheter and then deposit the catheter onto the tray. You can open up the packaging and lay it beside you, and then pick up the catheter with the tongs. Or the way I prefer to do it is to open the catheter packaging like this, ensuring that you are not touching the tip of the packaging. Then with my sterile tongs, I remove the catheter and put it into my tray, like that. Now I'm going to expose Mrs. Jordan, and I'm going to ask her to put her legs, her feet together like a frog-like position, and I'm going to expose her. And from this point, Mrs. Jordan, you're going to have to stay very still because I'm going to put my drape on. And from this point forward, everything below your waist will be sterile. I'm going to sanitize my hands again. And I am going to don my sterile gloves. So my dominant hand first. And then my non-dominant hand. Okay, so now I have my sterile gloves on. I can touch anything in my tray with both hands. So I'm going to, again, this catheter packaging is perforated so that I can pull the catheter out. And I want to make sure that I keep it as close in my hand like this so that it doesn't swing around and get contaminated. Then I'm not going to need a specimen today, so I'm going to put this specimen container over here because I don't need it. I can pick up my whole tray and I can check that I have my container with my cotton balls. And I'm going to, this particular catheter tray has betadine in it, iodine, so I'm going to open my packaging and I'm going to pour it onto my cotton balls, saturating them. Okay, so I'm going to have done that. Then I have my sterile forceps, which I'm going to sit inside the container with the cotton balls that are soaked in my iodine. I'm going to open up my lubricant because I'm going to need that to lubricate my catheter. So I'm going to put that lubricant on the edge of my tray so that I can roll my catheter into it. And finally, I'm going to hook up my catheter, the syringe, onto my catheter. Now, the new edition of Canadian Fundamentals suggests that we do not test the balloon at the tip of the catheter. But in the previous text, so in the revised 4th, Potter and Perry suggest that we do test the balloon at the tip. That would also depend on your agency. So your agency may recommend that that balloon is tested first, and yet the new practice in the 5th edition of Canadian Fundamentals says we don't. But if your agency suggests that you do, it's important that we just push the tip of the syringe, and basically when you're testing the balloon, you're testing that it fills just as this does without leaking any fluid. So then you just let the syringe come back, and that's been tested. So keeping the syringe on the end of the catheter, I'm going to roll my catheter in the lubricant, and we are going to, for Aaliyah Jordan, we are going to insert the catheter 5 to 7 centimeters.
Okay, Mr. Fox, I'm going to go ahead and drape you now. So I'm going to be using this white drape. I'm going to make sure that I put the shiny side down, grab the edges with my thumb here, and bring in like so. And just place underneath the client. That way I keep my hands remain sterile. And now I'm also, Mr. Fox, going to apply this blue drape. Perfect. Oh. Let's just roll over there. There we go. And now I'm going to go ahead and bring my sterile field over to my client's perineum here, making sure that I'm within my 1-inch border.
If you felt that your client could not be compliant, this would be certainly a time when you would ask for assistance to perform this catheterization. So now I'm going to start by cleaning. I've placed my non-dominant hand, my left hand, spreading Mrs. Jordan's labia. And now I'm going to start cleaning. And as we do in terms of cleaning, we're opposite of that of the incision. So we're actually going from clean to dirtiest, and clean would be on either side of the meatus. So Mrs. Jordan, this is going to be a little bit cold. I'm going to clean on the farthest side first, top to bottom, 1 stroke down. And then on this side, on my side, top to bottom, 1 stroke down. And then down the center, top to bottom.
And now I'm going to go ahead and clean. So I'm going to use my non-dominant hand, and I'm grasping with my thumb and my forefinger here so that I can see the opening of the urinary meatus. And now that I've placed my hand here, this hand is going to remain here for the entire procedure. And I'm also going to be holding Mr. Fox's penis in a perpendicular position. So now I'm going to go ahead and clean with the cotton swabs here. So I'm going to be cleaning in a circular motion. I'm going to clean around and then down and then discard. And I'm going to do that 3 times. So around, down, and discard. Around, down, and discard. So now that's clean. Now I'm going to insert the catheter. And for the male patient, we're going to be inserting 17 to 22 centimeters. And if you happen to feel resistance, that we don't want you to continue against the resistance. So I'm going to be holding the catheter about 10 centimeters from the tip. I'm going to grab the other part here. And then I'm going to ask Mr. Fox to bear down. So Mr. Fox, can you bear down for me like you feel the urge to urinate? And then I'm going to go ahead and insert the catheter, 17 to 22.5 centimeters, until I get urine return. And now I have urine return. So I'm going to go ahead and insert it another 2.5 to 5 centimeters. There we go. And now I'm going to inflate the balloon. So I'm going to inflate the balloon with 5 mils of the sterile solution. So I've done that. And I'm going to disconnect. And now I'm ready to attach my catheter bag. So I'm going to grab the tip of my catheter bag, remove the blue cap so that my tip remains sterile. And I'm going to go ahead and connect it to the end of the catheter drainage system here. So I have that, so that's connected, and now the urine is draining into the catheter bag. So now I can go ahead and remove this drape.